What's up, directors? Grab your knives. It's time to take all of the lies.
In doctor-patient settings, nonverbal communication can often be as important as verbal diagnosis they accompany. We have personally examined several areas of interest. These include touch, tone, over-communication, territory, and convergence. What reaction from the two videos you're about to see do you think will result in more patient satisfaction?
Hi Alicia, how are you doing? Well, everything looks just okay. Everything looks okay. Just mediocre. How's your fever doing? That's okay. Everything's okay. Don't worry. Hi Alicia, how are you doing? Well, everything looks okay. It's okay. How's your fever? Alright. It's alright. Just gonna have to take a look at this.
Trick question. Doctor's tone is irrelevant whether it's angry or happy, according to Stretcher. Research by Rusher indicates that prejudices and stereotypes are prevalent in everyday communication. Over-communication becomes especially harmful in doctor-patient relationships. Here's an example.
Hi, I'm Nurse Hong. Hi, yeah, so looking at your medical records, you know, since you're, you know, female, you know, blonde, among a lot of other things. We're just gonna try to tell you some things. Try not to get too emotional here. You know. But yeah, we're gonna try to explain some things to you. Some procedures we're gonna do. Maybe you're not really used to the terminology we might be using. So I'll try to talk really slow, okay? If you have any questions, you can just ask me. Just don't hesitate to ask me, okay? All right? Okay. All right.
Over-communication, or talking to the prototype of a person you have in your mind based upon the physical characteristics, is common. However, in doctor-patient relationships, over-communication is especially offensive. The doctor should have one standard for everyone, and no one should be treated differently based upon their traits or appearance. Sundstrom and Altman say that people often seek an optimal personal space. However, in doctor-patient interactions, this distance is often compromised. Nurses often forget that they violate a person's most important personal space, specifically their bodies. At times, according to Stillman, the patient feels that he is treated as a non-person.
What are you doing?
The doctor will be here shortly.
Do you need something?
No.
In doctor-patient relations, it is imperative that doctors and nurses remember to respect their patients' personal space and bodily territory. According to Callan and Sparks, convergence, especially gesture, increases the quality of interpersonal relationships. Now, watch as this nurse tries to gain approval from her superior by attempting to converge.
You nurse, come in.
Hi, Dr. To. I'm Alicia. I'm the new RN here. I'm really excited to work with you. I know that you're from California. I'm from California too. And I read all about you, and I read your bio, and I picked this hospital specifically because you work here. And I can't tell you how excited I am to be here with you. I'm just like you in every way. I know about your likes and dislikes, and I like and dislike all those things too. So I think that we're going to get along really, really well.
Since the doctor is in a position of authority, the nurse wants to converge and become more like her. The doctor is assumed to be a fast talker with a bubbly personality, but the nurse needs to be cautious. Some convergence is good for acceptance and liking, but too much will have the opposite of the desired effect. According to Hall, physicians should touch patients, but only in the proper areas and with the proper cuts.
Hi there. What are we doing for you today?
Hi. Just pickup, I guess.
Checkup? Okay. Is this for a yearly checkup, or what is this for?
I've got a cold.
You have a cold?
Yeah.
Okay, well this is no problem. It's gonna be no problem. We will get this taken care of right away. Then we get to go, alright?
Okay.
Alright.
Alright.
See you in a bit.
Furthermore, the touching does provide some benefit, but it should be only kept to areas that are safe for personal contact, such as a shoulder or a hand. Speaking of a nose, that's not really a safe area.
Hi, Christopher?
Hi.
Hi, Dr. Pekema. Nice to meet you. What can we do for you today?
Just for a checkup, I guess.
Yearly checkup?
Yeah.
Did you come last year?
I did.
Great, okay. Well, sit there on the bed and we will get started very shortly.
Thank you.
Great, nice to meet you.